The genetic disorder that I have chosen to discuss is Turner syndrome, or another name for that would be 45X syndrome. It affects females. It is characterized by the partial or complete loss of the second sex chromosome. So with a normal female, there are two X chromosomes, and with this disorder, there would be a loss of that partial second or complete loss of that second chromosome. So in normal females, there is a SHOX gene. That's a gene that's encoded by a protein in that second chromosome, and with this disorder, there is not that gene, and it is not present or it's partially lost. So this affects 1 in every 2,000 to 2,500 females. There's no known racial or ethnicity influence, so they have, no specific type of female. So it is estimated that there are more than 70,000 women in the U.S. that have Turner syndrome. Some of the symptoms for Turner syndrome include short stature. So a female may initially exhibit normal growth in the first few years of life, and then it would drop off. Another would be premature failure of the ovaries. So that would be a failure to initiate puberty. Some other symptoms that you can have with Turner syndrome include a short, webbed neck appearance. You can have a low hairline at the back of the neck, low set ears. You could have narrow fingernails and toenails that turn upward. And then you could have an appearance of a shield chest. With some, they have white spaced nipples, and then they can exhibit lymphedema or swelling in the lymph nodes as well. So some can also have heart and kidney anomalies, so you could exhibit a horseshoe kidney or no kidney at all. Some of the heart defects that you can see, in 5 to 10%, they have coarctation of the aorta or narrowing of the aorta, causing the heart to have to pump harder. That is not usually diagnosed until adulthood, depending on the severity of it. So with females with Turner syndrome, they will require hormone replacement therapy. With the diagnosis, it's usually diagnosed after birth. And if it's a mild case, sometimes it's not diagnosed until adulthood or until females are trying to conceive and unable to. With the confirmation of the diagnosis of Turner syndrome, you're going to have a chromosomal analysis, and that's going to show that second sex chromosome, or that X, is partially or completely not there. With the diagnosis of Turner syndrome, you would have an evaluation of bone age, so you would do an x-ray to see, depending on the age of the child, to see where they're at in their growth plate. You would do an MRI, and that would be to check for any kind of anomalies with the heart or kidneys. With the treatment, you're going to have, if before puberty, you're going to have hormone replacement. That is going to be to help initiate puberty. It's usually began between the ages of 12 and 14, just to make sure that they do go into puberty. Some of the, with Turner syndrome, women are infertile, and in adulthood they will have to go through IVF or in vitro fertilization with a donor egg and sperm, and that would be how you would be able to conceive, because with Turner syndrome, women are infertile.